Ladies and gentlemen, welcome back to Room 1 Podcast. I have Dr. John Bergman with me here today from Huntington Beach, California. He will be the opening speaker for Room 1 here in Las Vegas, April 20th and 21st. Dr. John, welcome to the podcast. It's good to have you.
Buddy, thank you so much. I mean, to be invited back for a year or two, this is going to be amazing. It's so much fun. I learned so much when we were there last time. And I know when you're out there speaking, just to hang with your colleagues, but to see top level information, all of this equates. The knowledge that you gain from here, you can directly translate into the practice to make it a difference in people's lives. Thank you so much for setting it up.
Oh, it's our pleasure. So this year, and you know, if anybody can communicate the message of chiropractic to the public, it's definitely you and your outfit. You have that message really cleaned up so people understand it and you make your points quickly. How do you do that in a nutshell?
It's kind of fun. See what they're teaching now in schools, and I'm hiring a couple new docs, and I'm seeing the quality of education coming out of the schools, and they're very, very good at passing boards. But he asked me, he says, why are you not diagnosing? And this is how you communicate it down, because people are taught erroneous information. And I told him, I said, okay, we got 5 people here. We got a 23-year-old, 33-year-old, 46-year-old, you know, all different ages. All 5 people have fibromyalgia. What's the cause? And it was like all of a sudden a pattern interrupt to what's the cause? Well, we just give them the same label. And then we give them the same therapies. But if you're doing that, that's a dogmatic approach. And it's not looking at the individual and their response. And then you start taking it over to that fibromyalgia doesn't even exist, that it could be an adaptive response based on each individual's physical, chemical, or emotional stress. And that's how we break it down.
You are implying our bodies are smart.
Yeah, I actually had a medical doctor at our blood pressure and cholesterol conference tell me that the body is not smart.
Really?
That's exactly what I said.
Okay.
It was like so far afield from common sense and just empirical data. And he's saying, no, the body isn't smart. Sometimes it'll raise the blood pressure. And I said, really? Any animal species on the planet can't regulate their own physiology, or is it just humans? And it was like he was gut shot then. I never thought of that. He came back to me and said, well, I'm not an expert in other animals. And I said, okay, well, you're not an expert in humans.
I love it.
In the healthcare field, we've separated it so much from the average Joe. And that's also in practice management or communication, or anytime you're having an interaction with somebody. In the healthcare field, we still use Latin terms. We're still calling, you know, brachioradialis, you know, all of this stuff is, you know, biceps brachii. We're using these terms to name certain things, and it's all Latin, so it separates us. So what I do is I break it down into normal. You know, I'll tell them what they actually have been told they have, and then I break it down into what really is going on, and then how the solution is to get their body to optimal health.
Sure, and so what that's a lot of times doing is these diagnoses and stuff that are in the traditional medical model are treating people as though they're not smart enough to understand, and you're just helping them understand the terminology so they know what those things mean. Is that right?
Yeah, and also to explain, like let's say you get the standard person, and this is like virtually every patient that comes in. I'm saying, you know, 80+%. They're taking blood pressure, cholesterol, and type 2 diabetes medications. And I tell them, I said, look, you know, you don't have these diseases, okay, that your body is responding to physical, chemical, or emotional stress. And you could see that their brain just isn't kind of understanding it. And I'll say, look, if your body was in a trench in World War One, how would your sleep patterns be? Well, poor. How would your stress levels be? High. How many bowel movements a day are you going to have? Oh, one if you're lucky. Yeah, because you're in that stressed environment. So what we have to do is not treat the high blood pressure, treat the high cholesterol, or treat the type 2 diabetes. We find out what physical, chemical, or emotional stressors are causing your body to respond intelligently. And we're sure as heck not going to give a beta blocker, diuretic, ACE inhibitor to decrease your stress response. That's insane. Okay, we find out why the body is intelligently responding that way, because the body always is correct.
That makes so much sense. So what is, and you, okay, I'm going to back up just a little bit and ask you this question. I think that chiropractors should be the authority on healthcare, on wellness healthcare. I understand the medical system should be the authority on emergency care.
Mm-hmm.
But I think chiropractors should be the authorities on healthcare. What is one thing that chiropractors could start doing to move into that position of authority?
Oh, go back 40 years to what we were practicing. Okay, chiropractors. What a chiropractor is and what a chiropractor is not. Okay, there's what we are a distinct, separate, drugless healthcare profession. We are masters of the autonomic nervous system. And in fact, the purpose of the adjustment is not to move the muscle or bone. We're altering the brain's proprioceptive response, or the brain's awareness of the body, and we change the autonomic nervous system. Bam! That's it. Okay, what we're not are musculoskeletal doctors. We're not running ultrasound on people's bodies. We're not, I mean, I don't deal with insurance at all, but look at that. We're not working on symptoms. We're restoring that brain to body communication, and that restores optimal physiology. We're doctors of the nervous system. And if people own that, if chiropractors own that, because your body, the nervous system controls and coordinates every function of the body. This is fact, man. This is in every anatomy book. And the body's response to the environment is based on its perception through the autonomic nervous system. And that's how it's going to respond. And we can alter that. We alter the brain's perception of its environment by altering that sensory input. Then when you add in any stimulus that you can get up to that cerebellum, that little tiny brain, and that's going to be all the adjustments, it radically alters the frontal lobe. So we're changing brain function in the frontal lobe. You're talking impulse control, schizophrenia, depression, anxiety. It's all up there. And so those adjustments, that alteration in movement causes alteration in sensory input. We restore that motion, restore that sensory input. Man, that is primary care, because
That
most
makes
diseases,
absolute sense, yeah.
the diseases don't exist. That 97% of them, anyway.
They only exist when there's the lack of blood. That's wonderful, and your clarity to be able to communicate that will be powerful, and it'll be very useful for everybody listening there at Room 1 to see how you communicate these ideas so that they can use this type of language with their patients, so that their patients really get the big picture and buy right in.
Oh, I can hardly wait. It was so much fun. And last year you had such a big a cool lineup. I mean, I was just hand cramping with getting all the notes out. So
Nice. Good.
I'm excited to present, but I'm really excited to be there.
Good. Well, I know there's a lot of doctors across the country that are excited to be here, and some of them probably know they would like to be here, but they haven't made the decision yet. What would you say to people sitting on the fence?
You could probably get the videos afterwards, but honest to goodness, to be there with your colleagues, and we're not reinventing the wheel. The people that are speaking here are incredibly successful. I mean,
Exactly.
I remember when I was just starting out, I was so scared. I didn't know how I was going to get patients, or how to keep the patients, or even where my headspace was. And I remember looking at Sigafus and all of these great speakers, and I started to implement, started to hang with them. And in between that we're speaking, hang out with somebody that you respect or honor. Ask them what it was like to start out in practice. You can only get that experience from being there. And when you're there, believe me, everybody is open. If anyone comes up to me and they say, hey man, what's it like to see 1,200 people a week? I'll say pretty good. Just make sure you do it in 4 days.
That's great.
Because it's everything. It's not practice management. It's life experience. It's life management. If people knew what you did, they do what you do. And we've heard these cliches all the time, but it's true. And if you can really, truly own what a chiropractor does, by God, you're going to be so enthusiastic. People are going to be drawn from you. They're going to be like moths to that proverbial flame. It's like, where's this light source coming from? And if the chiropractors are able to express it only by going to groups like this, are they going to get that? They used to call it being dipped. Okay, yes. We have chiropractors. We had one guy there last year, and it was funny. I still keep in touch with him. He hadn't been to a real motivational philosophy, neurologic based practice technique based seminar, okay, in 30 years. And he'd been in practice for 40.
Yes.
And he came out of there on fire. And this one, it has never been more true. What happens in Vegas cannot stay in Vegas.
I agree with you. That was great. Yes. And all of those are wonderful reasons for people to actually be there. And I want to just say to everyone, if you don't know who Dr. John Bergman is and you're watching this, you've got to look him up on YouTube, because being able to spend some time in person with him to ask these kinds of questions would be very useful to you. So here's how you get to the event. Go to room1lasvegas.com. That's www.room1lasvegas.com. Right now, you'll save $50 on your tickets when you buy them now. Okay, and then you can get 15 hours of CE credit if you're a chiropractor. Just make sure your state's approved. It's 40 out of 50 states that have 15 hours of CE credit approved in them. So that's an extra benefit this year. Room1lasvegas.com. Get your tickets there. Any closing thoughts?
Just, man, do whatever you can. Get there and talk to everyone. Talk to everyone. You're going to develop patient communication skills and a knowledge base that's going to light your practice on fire.